Hello, everyone. I'm Brandon Hawker with the Open Minds Market Intelligence team, and I would like to welcome all of you to today's Circle Elite Executive Roundtable, Fostering Innovation and Entrepreneurship with Managed Care Organizations, the VOA and Humana case study. Today's roundtable features Stephen Samuels, Vice President of Innovation and Impact Investing for Volunteers of America, Abby Gilbert, Associate Director of the Office of Health Affairs and Advocacy with Humana, Claire Hersig from Let's Get Set, and Alec Johnston from Lifting Up. Stephen Samuels is Vice President of Innovation and Impact Investing for Volunteers of America, one of the nation's largest and most experienced nonprofit health, housing, and human service organizations. In this role, Mr. Samuels directs market-driven business growth with multi-sector partners for scaling the integration of health and housing solutions, expanding value-based healthcare service lines, and piloting new mission-aligned social enterprises. Mr. Samuels oversees VOA's impact investing subsidiary, the Futures Fund, and its newest community health incubator program, sponsored by the Humana Foundation. Prior to joining VOA, Mr. Samuels was the Greater Kansas City Executive Director for Local Initiatives Support Corporation, LISC, one of the country's largest community development financial institutions. He has degrees and certifications in urban planning, business real estate, and venture capital. Abby Gilbert is an Assistant Director with Humana's Office of Health Affairs and Advocacy, supporting physician relationships, government affairs, thought leadership, and the company's population health strategy. Connecting together with state and local health initiatives for the benefit of members, employees, and the community at large, Ms. Gilbert began her work at Humana in 2014 in management consulting, where she worked with the company leaders to define and evaluate initiatives, lead counseling, engagements, and work on specific project goals for the executive leadership team. In 2012, Ms. Gilbert was named one of Louisville's best business first 40s under 40. Alex Johnston is the CTO and co-founder of Lifting Up, a social impact startup that leverages technology to make social service delivery smarter. Their platform, Smart Services Alerts, allows communities to connect the dots between early identification and intervention for youth impacted by trauma and adverse experiences. Alec has a BS in computer science from the University of Nebraska-Lincoln and previously worked for one of the largest electronic medical records providers in this country. Moderating today's roundtable will be Kim Bond, Executive Vice President, Open Minds. Kimberly Bond brings over 30 years of experience providing behavioral health treatment in the public and community settings to the Open Minds team. She currently serves as the Executive Vice President of Payer Provider Markets, and in this role, Ms. Bond provides executive oversight and leadership to all provider and payer client engagement for Open Minds. Prior to joining Open Minds, Ms. Bond served concurrently as a Program Coordinator 3 and Clinical Manager of Adult Services and Program Coordinator 2 and Clinical Manager of Recovery Services for the Ozark Guidance Center. Prior to joining the Ozark Guidance Center, Ms. Bond served as the Executive Vice President of Centerpoint Inc., a large substance abuse provider agency in California. Previously, Ms. Bond served as the President and Chief Executive Officer of Mental Health Systems, Incorporated. Ms. Bond received her bachelor's degree in psychology with honors and her master's in counseling education from San Diego State University. She is licensed as a marriage and family therapist in both California and Arkansas. Last but not least, Claire Hersig is the CEO and founder of Let's Get Set, a mission-driven fintech and making wealth building possible for 90 million households making less than $70,000 a year. Their app and text line first help parents claim their piece of the $12 billion in tax credits that get missed each year. Her passion for economic mobility has fueled her decades of work funding and scaling mission-driven initiatives in low-income communities. As Director of Strategic Initiatives at First Place for Youth, a California-based nonprofit providing education, employment, and housing to youth aging out of foster care, she led a team to enable expansion into Mississippi, Massachusetts, and New York. Prior to that, she worked for a foundation investing in national youth serving nonprofits. She also serves on the board of the PD Green Program, a national nonprofit providing tutoring to incarcerated people. Claire has an MBA from MIT and a BA from Princeton in public policy. Before we get started, a few housekeeping reminders. Your audio will be muted during today's briefing. However, we encourage you to submit any and all questions you may have using the question box located on the right side of your screen. We will present audience questions at the end of the presentation. Finally, the slides and recording for today's briefing will be available on the Open Minds website by tomorrow. All right, Kim, I'll turn it over to you.
Thank you, Brandon. Welcome, everyone. Welcome to our webinar today on fostering innovation and entrepreneurship with managed care organizations. We're going to be talking to VOA and Humana case study and see what they've been doing, and so excited about this. Can we go to the next slide, please? Just a little bit about today's presentation, because we've got a packed presentation, so I want to turn it over fairly quickly to our panelists here. So most of us, if you've worked in community behavioral health, community health at all, you've been familiar with what we now call social determinants of health. I heard someone one time call them social drivers of health, which I liked a lot. But just to refresh everybody's memory, when we're talking about social determinants, we're talking about economic stability, education access, the healthcare access and quality, neighborhood and built environment, and the social context, the community context. So as I said, we've been worried about these things, and we know how important they are to the well-being and to the positive outcomes for all the people that we serve. And we're really happy that the health plans are finally agreeing with us and getting on board and really helping supporting some of these programs. And it's because they also know that the total healthcare resources, if you have a behavioral health issue and a physical health or other cognitive disorder, you're also always going to have higher healthcare. But they also know that those social drivers really impact the total cost of healthcare spending. So in addition to just making life better for our consumers that we serve, they also are saving money on the total cost of care. So we're really happy that health plans and others are finally understanding the importance, and they're joining us. And that's what this presentation is all about. How we show how one provider organization has partnered with a health plan to address some of those issues, especially around economic stability, but also the impact, the value of that social impact investing and community health incubators. Let's talk a little bit about what those are very quickly. Stephen, the next slide, please. So with VOA, they launched back in 2018, a subsidiary of Volunteers of America. And for those of you that don't know, Volunteers of America is one of the largest nonprofits in the country. But they launched a Futures Fund, and that's a social impact investment fund. And they really are looking at impacting health, housing, social service models, and enterprises, not just within VOA, but with external community entrepreneurs as well. They provide that capital, the training, the coaching, just to test that new ideas, to foster innovation, to really help us think outside the box and how we can help a wide range of our consumers and the people that we serve. They really want to support that nonprofit innovation for culture, organizational culture, and to increase the capacity for the people we serve, and to advance the racial and health equity, which is so important in everything that we do. So I'm really looking forward to hearing the discussion today, hearing more about this program, and what people have to say. And just, I'm going to turn it back over to you, Stephen, and teach us, please teach us.
Okay. Thank you, Kim. I'll try to be brief because there's so many great colleagues here to also share. You've done a great job actually of giving an overview of VOA. You know, we are one of the largest nonprofit housing, health, and human service organizations in the country, and really for over a century now have been taking care of some of our country's most vulnerable populations, from homeless to veterans to seniors to at-risk youth to those coming out of being incarcerated. We are organized as a federated structure, so our headquarters is based in Alexandria, and then we have 30 affiliates across the country who really do that great work on the ground. And our name, Volunteers of America, just to get that out, is really a legacy name. We do this great work with nearly 16,000 employees that are on the front lines. I want to talk for a moment about our assets because it's very related to the theory of change model. In addition to our employees, we have a very robust portfolio of, I think today it's actually near 22,000 units of affordable housing, over 15 different kinds of senior healthcare facilities. We run PACE programs in multiple locations. We also have a new strategic plan that's guiding our work, and the conversation today really falls under our second strategic pillar, which is, you know, how do we grow and pivot this organization that's been around for so long to remain impactful, to remain competitive, which is what any good business needs to do. And and do that all with a very keen eye towards health equity. You gave the background of the Futures Fund. It was created in 2018 as a subsidiary, and the purpose was to try to be one method for accomplishing that level of innovation for the organization. It was capitalized with one of our corporate partners at the time, who we still have as a partner, Niagara Bottling. And what's really pertinent here is that when we created the Futures Fund initially, it was to invest in innovation and entrepreneurship within Volunteers of America. So the idea being to try to cultivate new business lines and enterprises utilizing the people that we have across the country. And so over $2 million was invested in the first couple of years to make that happen. The theory of change is that we've got this incredible portfolio of assets at Volunteers of America, and I'm not talking really about our balance sheet. I'm talking about those employees that we have, the 1.5 million lives that we touch every year, the level of expertise that we have from doing this work for so long, being on the ground in community with a brand and a reputation that people trust, and then our huge, robust portfolio of programs. And we always like to say that, you know, a homeless program in Greater New York is what the homeless program looks like in Greater New York, and it's not necessarily what it's going to look like in Salt Lake City. You know, all of our programs and services are very much customized to the local environment. So we have this incredible amount of assets, and we felt like if we were to provide an adequate level of coaching and mentorship, combine that with what we call catalytic capital, that we could achieve some of those key goals that I mentioned in terms of new business lines and innovation and entrepreneurship. When we launched, as I said, it was to invest the Futures Fund and build a portfolio of projects by working through our own organization. And the pivot that I'm really highlighting here today with my colleagues is that the board, 2 or 3 years into the Futures Fund, we worked with Rockefeller Philanthropy Advisors to look at our portfolio and how we were performing. And the big pivot that we made last year is to have the appetite and interest to invest in external companies who we felt their products and services could enhance the work of Volunteers of America. And in return, by leveraging those assets that I previously described, we could help those companies pilot and scale their early stage ventures. And so this was a way to basically mitigate the fact that an impact investing portfolio dedicated to just entrepreneurship within the company was not going to get us as far as we wanted to go in terms of that growth for the organization. So with the Humana Foundation as a partner, who is an amazing strategic partner to Volunteers of America today, both on the foundation side as well as on their business side, we launched a community health incubator to materialize this. Our first cohort was last year, and I'm going to talk a little bit and quickly, hopefully, about the successes as well as the pain points, because I know there's a lot of nonprofit organizations out there thinking about doing this themselves. Our first venture into this last year, we decided to bring both the VOA affiliates and early stage companies together for a singular path of coaching and mentorship and capital. And we felt that we could take them both along on the same ride, these two types of groups. Did a big call out. We had 60 plus early stage companies apply to be in. We had a half a dozen of our 30 affiliates apply to be in. And ultimately, we accepted 3 affiliates and 3 early stage companies. We used an incubator director who runs the USC incubator to be our director. And we designed what essentially was a 3-phase incubator model where affiliates ran through the first 3 months and we focused on them and tried to meet them where they were. And then we brought in the external founders, provided the coaching and the mentoring and the pitch development to ultimately end what was a 6-month incubator with the goal of having 1 or 2 enterprises that we felt could fit, our investment thesis and that we could put some capital into. And that capital could be debt capital, it could be equity capital. To get there, we knew that we needed a great brain trust. So one of the first steps we did was we created an advisory board. And you can see here, it's a really diverse, really well thought out group of folks from healthcare, health tech, entrepreneurship. An old colleague from LISC is here. So from a catalytic capital mindset, we wanted to make sure we had a Volunteers of America representative there that understood what the work looked like on the ground. And so they really, as well as helped us along the way, providing great consult. This is the cohort that we brought in. You're going to meet 2 of these companies today, Let's Get Set and Lifting Up, so I won't mention them, but Hamilton Health Box was the other company. They are a small footprint, hybrided primary and telemedicine company that had proven its model out in companies by putting a small healthcare clinic at large companies so that employees could access primary services, thereby reducing the costs of their self-insured programs. And they were interested in moving that model out into rural communities, and we thought that was a good match for us. The affiliates that we brought in included Southeast Louisiana Volunteers of America that was focused on medical respite, and Upstate New York Volunteers of America, which was focused on a hydroponic farming concept. At the end of the 6 months, we did a lot of data analytics throughout. We did a lot of pre-surveys, post-surveys, and I'm proud to say, in terms of entrepreneurship knowledge, it was clear that we helped people understand more about what it would take to launch an enterprise. One of our big value adds, we feel, is our ability to educate and talk about health equity. And all of our participants got a lot of value out of that, and were able to integrate that back into their business models. We brought a good team of mentors forward that we were able to recruit across the country who worked with each of these companies. We ended up focusing on 4 domain areas: behavioral health, economic stability, food, and healthcare. And then one of our key responsibilities, we felt, like I said earlier, was to try to help these early stage companies pilot and scale through partnerships with our organization. And so we facilitated a number of those discussions in the attempt to do that, as well as getting some media relations out there. Numbers are I think decent first year numbers, and we're excited as we go into cohort 2 in 2023. And I'll share for a minute here in a second what some of the pivots were, but I'm sure we're going to be exceeding those outcomes here this year. Here's some of the key things we learned from the first year experience. The affiliates within our company, our intrapreneurs, if you will, definitely progressed their business concepts. Southeast Louisiana has launched their medical respite program. They are looking for a location now. They found great value in learning about how to model that business, how to communicate that business, how to put pitches together for that concept. And they have therefore been able to go out and build the partnerships and find the funding to do that. Same thing with upstate New York and their hydroponic business. Really valued it. They really have come along. They actually have a board meeting today to talk about how to move forward with over $1 million that they were able to raise during the incubator period. We did realize one of the things we learned is that the staff in the incubator, probably we need to do more to make sure that senior leadership at our offices across the country are connected to this work, that they have the support they need. And probably the biggest takeaway from trying to cultivate innovation and entrepreneurship within a health and human service organization, where entrepreneurship is not necessarily their first skill set, is quite honestly the big takeaway. Putting these two groups together, early stage entrepreneurs who spend 100 hours a week on nothing but their businesses, and affiliates who are doing health and human service work and are trying to fit entrepreneurship into their daily lives. These are two very disparate groups, and they require two tracks. And one of the pivots that we're making in 2023 is to separate them onto two different tracks, to bring them together at times to learn about health equity and to learn, the startups want to learn about community-based health, and they can learn that from us. But in terms of the business coaching and the skills, these two groups need that delivered in two different ways. Health equity is critical, and of course more visibility. We realize, building more partnerships in order to do an even better job at sourcing the kinds of companies we can attract. So this is where we landed as we worked with the advisory board on this next cohort. What our startup founders want out of a community health incubator, where a healthcare organization like Humana is partnered with an organization like VOA, what the affiliates need, and then to be really clear on what we can provide as volunteers of America. With that, I told you I'd try to be brief, and so Kim, I can always answer more in questions later. But I want to turn this over to our greatest success story, I think, out of the incubator for us in terms of that investment thesis, and that's Let's Get Set. One of the three companies that went through it, one of the companies that we have succeeded in arranging two pilots with two of our affiliates, and unofficially, documents not signed yet, but we are committed to making an equity investment in Let's Get Set alongside some other impact investors in the field that we're really proud to be working with. And so with that, I'm going to turn it over to Claire and let her tell you about Let's Get Set.
Awesome. Thank you so much, Stephen. So hi, everyone. I'm Claire. I'm the CEO and founder of Let's Get Set, where we're building a mobile platform to guide low-wage households on paths to financial security. And we're here today because, as Kim kind of teed up for us, right, economic stability and specifically financial health is one of the key drivers of health equity. And that was really our focus in this incubator. Next slide, please. So our first product focuses on tax time, and for low-income families, tax time is actually the single most important financial moment for them to get right in the course of a year, and that's because they're getting the largest influx of cash that they're going to receive all year. And yet, these households are actually leaving $12 billion unclaimed because they're not filing their taxes because they legally, don't have to, or they're filing and they're making mistakes and they're leaving these credits unclaimed on the table. Next slide. So we've built an app and a text line that guide low-wage households through tax season and beyond to get the $5,200 that they risk losing. So the app itself has a series of individualized tools to help families decide that it's even in their interest to file taxes. We help them know what forms they're going to need to file, and then they can file taxes directly with us or with partners. And throughout that whole process, they're supported via text, which is really important for this population. They have a direct line to us where they're receiving automated reminders and nudges, and they're able to get questions answered. Next slide, please. So as I alluded to, financial health, obviously huge driver of health equity, but tax credits specifically are one of the most impactful ways to combat poverty and to improve maternal, infant, and child health outcomes. And there are a series of RCTs and different studies that prove this out again and again. And that's really why we focus on starting there first. So there's a series of benefits for moms. Reduce stress, reduce smoking, increase spending on preventative health care, but also benefits for the children themselves. So reduced ACEs, increased birth weight, increased nutrition, and improved mental health. Next slide, please. So given that we're focused on this demographic, folks making less, we can serve anyone making less than $70,000 a year, but our core focus really are on families and specifically parents making less than $40,000. And we reach them through trusted messengers. So these are folks who work one-on-one with moms in our demographic, and often meeting with them, bi-weekly or monthly, and they're able to make a referral to us to support families at tax time. And we've done this successfully with healthcare professionals, so doctors, nurses, and also with human service organizations, right, like VOA, to empower those frontline workers to, again, make sure families get these benefits. And I would say this is one of the main ways, as Stephen kind of teed up for me, that we got a ton of value out of the incubator, was in cultivating 2 partnerships with VOA affiliates. Next slide. So last year, we started out a bit small, but honestly, we helped 1,400 families secure $9.3 million in tax credits, which is a lot of money, and a lot of money for those families. So this year, we're really looking to scale up that impact this tax season. We're on track to reach 40,000 families with our technology and with our partnerships. And we're partnering with nonprofits, healthcare providers, and healthcare payers. Again, these folks employing trusted messengers who care about health equity, financial stability, to unlock these benefits for new moms. And a couple of things I just want to highlight that's really unique about, I think, what we've built is that we're really, like I said, laser focused on these families that are at risk of missing out on this money. So last year, 41% of our clients made less than $19,000, which if you are a single mom, filing as head of household, you legally, with a W-2 job, you legally don't have to file. And so these are all folks kind of at risk of not filing. 65% of our moms were moms of color, which we're really proud of. Racial equity is something that we center and is really important as we build technology to reach low-wage communities. And 95% of our clients were moms. Again, we're focused on this mom demographic. Next slide, please. So that concludes my presentation. If you are interested either in partnering or learning more about how we're working to empower healthcare workers on the front lines, partnering with Medicaid payers, please reach out. You can reach out to myself at this email on the screen or to Erin, who leads our partnerships work. So with that, I will turn it over to Abby Gilbert.
Thank you so much, Claire, and good afternoon, everyone. Abby Gilbert from Humana. I'm very excited to just help tie a few things together around our relationship with VOA and how we think about the work that both the affiliates do, but also these great companies that you're hearing about today. So to take a kind of a step back, I think that ultimately, we really believe that we all have aligned strategies of linking together health, environment, and the resources that people ultimately really need in order to be healthy and stay healthy. And it's really important that all of us as partners have the same shared goals around the quality and the value and how we need to focus on those things to really improve the lives of the people that we're serving together. So right here, you kind of just see the 4 categories that I think that we're all focused on together, which is really eliminating disparities, ultimately in helping to increase capacity. So I think that works for both how we think about Humana helping to increase the capacity of providers like VOA to serve more people, and also increasing the capacity of these great companies that you're hearing about today. Thank you, Stephen, that you're hearing about today. And ultimately, we all have the same still goals around reducing cost and improving quality. Just quickly, I thought it would be helpful for us to just talk a little bit more around some of the work that we Humana are doing with VOA, in addition to how we're thinking about the companies that you're hearing about today. But ultimately, we're focused on advancing a more equitable healthcare system where your social needs do not determine your health outcomes. And over the past several years, we're really working with VOA in several different areas. And the first one of those is really behavioral health with wraparound services. So programs like supporting opiate addicted mothers and families on their journey to wellness and health, and really the idea that we're focusing on all those social determinants of health that they need help addressing in order to be successful longer term in their recovery. The same for some of our members and community partners that are thinking about the justice-involved population. So how are we thinking about people that are re-entering the workforce that maybe need help, getting connection to resources, getting not only help for, behavioral health issues, but also just general things like housing and, basic primary care or other health-related social needs. The second bucket is really what we think about around housing, so in wraparound services. So primarily now that work is focused in our senior population of Medicare, and how we think about place-based care. So those people are really living in VOA, wonderful VOA affordable housing, and how we work with VOA to not only bring healthcare closer to those members in their homes, but also social workers and nurses and all the community-based health programs that ultimately can help people stay healthier and stay out of the hospital. And then the last bucket of work that we really think about is what we call community health. So that's everything from community health worker initiatives to some new great workforce development initiatives that we really are trying to invest in and help VOA to scale in order to reach more members. And then obviously the community health incubator, which you guys are learning a lot about today. So Stephen, next slide. Okay, thank you. And so the last thing that we're going to talk about, I know we have another great presenter, but we are going to have time for questions at the end, is just really how Humana, along with our partners, really think about health equity being centered at the work that, at everything that we do. So not only are we understanding and identifying the root cause of disparities, but ultimately understanding that work, having really finding out what it is that people need, and ultimately working together with partners in the community like VOA, like these great companies that you're hearing about, to really understand how we can make more sustainable and scalable solutions for our members. So just a little bit about the process. So how we think about first, like I mentioned, identifying those disparities and really thinking about prioritizing issues like, if members don't have housing, or we know that there's not food, it's harder to think about those other health decisions that they're trying to make for them and their families. And then once we identify that, again, really thinking about who those partners are. What are those existing things that are already happening in communities? What are the companies and other partners that we need to partner with in order to bring those services and to help fill gaps? And then ultimately then how we test and learn in small scale environments in order to really understand what interventions are working and successful, right? It might be a great idea, but is it really gonna work for the population and the members that we're trying to choose? And then last, really, again, once we've identified and partnered and scaled, like how can we really invest in the capacity building of those organizations that are providing the services so that we can ultimately get to more members. So I know we're excited. I'm gonna turn it over to Alec, and he's gonna share a little bit more about another solution and company that came through this VOA partnership. And then I think we will be wrapping up in order to do some questions.
All right. Hi, everyone. Thanks for having me. Again, my name is Alec Johnston. I am the co-founder of Lifting Up LLC, and I'm here to tell you briefly about our product and technology platform, Smart Services Alerts, and our work with VOA and Humana through the Community Health Incubator. Go ahead and next slide. Thanks. Our mission is to automate and improve communication between first responders and schools, and to help our communities better support children that are impacted by trauma. Next slide. Why is this important? There is a lot of research out there showing how trauma changes the physiology of a growing child's brain. We know that adverse childhood experiences, or colloquially ACEs, not only negatively impact your long-term health, they also negatively impact how children perform at school. The bottom line is that when a student is in trauma brain, they cannot learn effectively. But there is hope. When communities provide early intervention, monitoring, and support, we can mitigate or even prevent a lot of these negative consequences of trauma. Here's how it works. We receive data from first responders every morning pertaining to qualifying traumatic events that have occurred in the community. We then will cross-reference that information with student directory data from the school district, which we also receive daily. If there is a match between these two sets, we send an email to designated and trained champions at each building. And on the next slide, there's a little example of what this email alert looks like. So this helps schools and educators, health workers, and social workers who work with children to identify which students have been impacted and when they need support. Go ahead to the next slide. Thank you. The second stage is monitoring. We provide districts and schools with a data dashboard so that they can track trends, at the district, the building, the grade, the student level. One big example of that is we track the cumulative impact of traumatic events on each student. So a big example for us is when a child reaches 3 alerts, the research shows that that's strongly correlated with a lot of negative health and education outcomes. So at that point, schools often choose to bump that child up to a higher level of support within the systems that they are already using today. So this data at an aggregate level can also be used for strategic planning and resource allocation. And then lastly, of course, the alerts are used to provide timely and relevant supports to impact students. This can include a pretty wide range of options, and the support staff use their judgment and to determine what each student is going to find helpful. And I have a pretty wide variety of examples here. A big one that we've been working on recently is IEPs and how that can help special education students. And these supports are key to mitigating the potential negative effects of trauma. Next slide. So we've come a long way since our inception, and we have pretty big goals in 2023 thanks to our time with the Community Health Incubator. They connected us with industry experts for mentorship and potential partnership, and they've definitely helped pave the way for us to grow this coming year. They helped us better understand how our work relates and impacts the social determinants of health, and how that aligns with the vision of organizations like Humana, who are working to improve population health, prevent community violence, and provide trauma support. During the incubator, we were able to connect with several VOA affiliate sites, and we're currently in conversations with 3 of those, I believe, for potential pilots. Thank you so much for having me, and if anyone has any questions, definitely feel free to reach out to me. The email on the screen is my co-founder, Katie, and you can also reach me at Alec at Lifting Up LLC. On that note, I'll pass it over to Brandon for questions.
Thank you very much, everyone. That was a fantastic presentation. We do have lots of questions. So Stephen, I'll start with you. The first one says, Stephen, I appreciate your statement about being clear regarding what VOA can provide as applicant expectations may be different. Have you noticed major gaps in applicant expectations and what VOA can provide? If yes, how will that inform future endeavors? And if not, to what do you attribute that to?
Is this in regards to the applications that from companies to be in the incubator?
Yes, sir, I think it is.
So we have yet to call for applications for cohort 2, but I'll say for cohort 1, we tried to get really clear on our thesis for what we were looking for. And some of those things off the top of my head, of course, were a focus on health equity, community health, the proximity that the founders had to the actual problem, like their familiarity and what they resonated with. Like any incubator, who the founders are. The stage of the company is important, so that they had a minimal viable product and some illustration of revenue. So not too early where they were still just kind of ideating and testing, but far enough along that they had some kind of proven model. But we kept the field of social determinants of health rather broad. So you can see, I mean, we had a fintech company, we have a behavioral health, tech company that focused on children, and we had this integrated primary and telemedicine company. I like being broad and open like that, because the kinds of ideas that we saw, we just, you just can't anticipate everything that's out there where all of this innovation is happening. So we're going to still keep it relatively broad going into next year, but some of those key guiding principles will remain in place. And with the Humana Foundation, we have some narrowing. They do have a geographic focus where we'll put some emphasis. They have a bit of a population focus where we'll put some emphasis, but it won't be exclusive to those things. But that is often the case again with incubators and accelerators. Based on your sponsor, your funder, there might be a particular theme that they want to see or a particular geography that they want you to focus on, and that's certainly the case for us here.
This goes along directly with that, actually. It's what characteristics does a future fund look for in external founders? You just mentioned themes and geographic areas. Is there anything else as far as past entrepreneurial experience or financial expertise that you look for?
We certainly do look at those things, but those are usually proven in the fact that they have managed to take their idea to the stage that they're at. So they've proven that they have that level of expertise and adaptability. But most people in the impact investing space that are looking at early stage companies will tell you the clarity of the problem you're trying to solve and the quality of the founder are maybe two of the most important things, because the product and the service are going to adapt. They're going to have to. They're going to change. I mean, what they have today will probably evolve a year from now and 2 years from now. But what they're going to stick to is that they're trying to solve for a very specific problem that is near and dear to them, and that they have the team and the skill set and the personality and the perseverance to go on that journey relentlessly. And so that's what we look for, and we rely on our advisory board and other experts in the field to help us pick those teams.
And sorry, I'm hunting through these to try and stay on theme. Along with that, does the Futures Fund have established benchmarks for selecting affiliates and external founders for capacity grants and pilot grants? Like, do you have potential profitability and potential impact, scalability, locally or nationally, service area, that kind of thing?
Short answer, yes. Yeah, I mean, we have a fairly long list, and I showed one slide that has some of the outcome measurements. I just picked some of the highlighted ones. There are subsequent data points and KPIs that are helping direct the incubator and how we report and how we are pivoting ourselves to be more effective. I'm happy to share those, subsequently.
Yeah, that sounds great. Does the Future Fund prioritize opportunities that will achieve large-scale economic impact versus smaller-scale community-based organizations with more of a micro focus?
I love that question. So that speaks to kind of what I think is a key difference between traditional venture capital and impact investing. So, venture capital is looking for ideas that can scale. They are looking to invest in companies that can produce 10x and 20x returns, and you can't typically do that at a micro level. We, as a nonprofit impact investor, we're not looking for venture capital market returns. We're looking to make deep health impact at the community level. And so we are very much open to kind of that community level business enterprise concept. And scale to us does not necessarily mean that it has to be national or global. Scale can mean sustainable. It can mean scale at the community level. And again, back to one of our key theories of change is that by partnering with Volunteers of America, it can be mutually advantageous to both the populations that we serve as well as to that entity.
This one I think is for Stephen and Abby both. It says social impact investing has more risk than traditional not-for-profit services. How has this increased financial risk impacted affiliates, and what challenges has it created in communication between affiliates and external founders?
I'll start by just saying that yes, impact investing, particularly at the early stage, does come with a large amount of risk. And that is the beauty of having a partner like the Humana Foundation, or any foundation for that matter. If you can use capital that is essentially capital that's not expecting market rate returns, that is concessionary, if you will, that gives you a lot of flexibility to lean over your skis and take risks. I mean, this is not money that I have investors breathing over my neck asking for it to be returned to them with any other upsides. If I do that, fantastic. But even their expectation is that any returns that we make on an investment will go back into the futures fund and back out into community. Those risks and rewards would be different if we partner up with more market-oriented investors. And we might do that one day, and then we'll have to kind of diversify our portfolio and strategies. Abby?
Yeah, the only thing I would add, I think Stephen's focused most of the concentration on the Futures Fund, which is the Humana Foundation, but we're doing a considerable amount of investment in partnership on the Humana Inc. side also, which is where I work. So not to get too complicated, but I think that we do both direct investment from the business, right, as well as, or how we're thinking about using healthcare quality dollars that are actually going towards services. But we also have a separate fund that the business funds. It's a $5 million fund specifically for some of the work around substance use. And I think that what my only build off that would be that the way some of the companies are looking at it, I don't know that they see the risk as much because they're not thinking about it from their investment portfolio standpoint, but maybe a pivot from how they would have traditionally spent dollars in communities, right? Or how the company would have used philanthropic dollars separate from the foundation, right? So any idea that there would even be a return, right? Or that the money would just come back into the fund in order to be used for something else, I think is really the exciting piece about the work. But to anyone who knows the space, it's very complicated and there are multiple things. So there is the foundation fund, there's the business has the fund, there is direct investment still, there is philanthropy, there are, and most of the work that VOA does may be a little bit different than the companies. There's also government grants still and other, philanthropic money that's really kind of bundled and braided together to make a lot of these deals happen. So I think the answer to that is I mean, my perspective would be, yeah, it's riskier, but it's also, we're pivoting the mindset of people that generally just thought of that money maybe as philanthropy and actually showing them that it could become something more.
And Abby, while I have you, another question for you. It says new innovations and services, like you were just saying, often require multiple braided funding sources. What work is Humana doing to integrate the multiple funding sources and investment from social to value-based contracting for services?
Okay, that was a doozy. So let me break that down, and I think I know what we're asking though. So the answer to that would be a specific example I can give that we just publicly announced in a Kentucky market. But I think the idea is, think about the work that Stephen is doing in the fund and how that does early stage investment to scale and build capacity of programs. If it's a new residential treatment facility that we're trying to build, right, there is opportunity to say, okay, what are the foundation dollars that are coming from that? What are the dollars that are actually maybe coming from a General Assembly or a state budget or ARPA funding, right, or opiate settlement dollar funding that's coming from the government? What is still coming from maybe the health plans, right, as they just give general non-restricted grants? And then longer term, how do we as managed care work to actually do payment innovation in contracting? So for purposes of the VOA example, we just recently signed an outcomes-based contract to say, listen, you're not only going to get reimbursed at whatever Medicaid is paying, but we're actually going to pay additional payment to you, VOA, on the great outcomes that you're producing. And as you pivot your payment model, right, away from air quote fee for service to this outcomes-based model, our fund is one of the things that can help them pivot, right, and absorb that risk that they're taking and moving towards an outcomes-based payment. So again, to add even an additional layer of complication to the example I gave before, I think you're seeing us and also us encouraging other managed care plans to do the same thing. Let's pivot from just paying for services to really paying for outcomes that are ultimately what everyone is trying to achieve together. So Stephen, chime in, because it's a complicated issue and sometimes I might even oversimplify it in my answer.
No, I think that was well said. I mean, there's just a lot of different ways to use capital these days. And I think that's where, a lot of the industry is going. We're trying to figure out how can we leverage multi-sector partnerships in new ways that in order to scale programs and services and use that capital to either de-risk or guarantee or meet, new impact investment strategies. So, there's just so many ways to kind of get there, and this is, pushing the envelope. I mean, there's a lot of testing and piloting going on.
Fantastic. Stephen and Abby, along with that, Abby, I think you pretty much answered most of this question, but do you have a specific message or value proposition that helps plans understand the need to invest in these deep community programs? For example, like what was the primary catalyst for Humana to join VOA in playing out these programs? Was it tied to health plan success or around social determinants of health, value-based reimbursement versus outcome-based care?
Yeah, so my answer to that is a little bit of all of the above. I think that when we, Humana is primarily focused on Medicare Advantage and serving Medicaid populations. So a lot of our members are in very vulnerable situations where they need a lot of social services and other things that are probably happening outside of what you would think of as a traditional, like I go to the doctor when I have strep throat, I go to the ER if I'm involved in an accident, right? We're talking about food insecurity and housing and all of these complicated things that VOA is already providing. So it only makes sense, right, for us to say, listen, there's no reason for us to build a medical respite facility for homeless. There's no reason for us to go and build recovery beds, right? There's no reason to do any of that other than like partnering with organizations who are already doing that, investing in capacity, helping VOA to scale. And then ultimately, I think what we see is if we don't help the long-term payment model, so if VOA primarily is operating and getting grants, right, to build more beds or to keep programs going, and ultimately those grants run up, then the healthcare system and the people who need those beds, that's no longer available. So if we help invest in the tough work that needs to happen to actually build sustainable payment models, ultimately, think about it. If there's 6 health plans, right, in Kentucky, we don't need all the beds. The other MCOs don't need all the beds at the time, but technically somebody always needs the bed, right? So it's a win-win, because I think that the focus on, again, not only the increased capacity, but really helping pivot these dollars out of healthcare spend into the social service programs that people really need in order to be healthy is not only solving the problem now, member needs a bed, right? But I think helping the overall pivot to how we're investing in the types of services that members need to be healthy. So I think it's all of the things. I will say this, there is significant complication. Anyone in healthcare knows when you're talking about public PHI, we're talking about claims payments, we're talking about cybersecurity, all of the things that make it harder for a health plan or a hospital to contract with a small provider, right? VOA really understands that, and I think at the national level has built an infrastructure to support all of those affiliates that Stephen spoke about, because it's silly to try to ask organizations that are really just trying to serve people and keep the wheels on the bus and keep programs and doors open to do the kind of innovation that we're talking about. And so I think it's also important for any health plans or hospitals or anyone that wants to get in this space to understand that you have to have the right organization like VOA, and there's many others out there. I think there's innovate all over the place, but just the idea that you have to have some of that national infrastructure or infrastructure built to do the extra work that we're asking people to do. So it's the same thing in philanthropy, the old notion of we want to only pay for programs, not administrative dollars, right? I think it's the same thing. We have to understand that all of this is creating new work, and ultimately if we want to get to the place where that work can be beneficial for the help for everyone, we have to invest in building capacity for the organizations to be able to do the new work.
And I'll also add one last thing that's not always said, and health plans have to work together. I mean, to accomplish community-wide health, everyone's got to collaborate. You can't just take care of my people and expect population health to improve if you just take care of my payers, my clients. And so that in itself is tough territory to get everyone to work alongside and understand that there's value in that and a win-win.
We have time for at least one more question. Alec and Claire, this is for both of you. As interested external founders, were you required to reach out to a local VOA affiliate to pitch your social enterprise, or what did that process look like?
I can go first and then pass it to you, Alec. We were not required to reach out to specific VOA affiliates, but I think obviously, like being thoughtful about how you can actually work with some of the VOA programs, right? Like we knew that VOA had this certain programs that were focused on, new moms in our demographic, and being able to speak to that and speak to how we could see partnership evolving. I think makes sense just from also if you're a founder, right? Like, does this opportunity, is this value add for your business, right? But also from thinking about like whether this will be successful. So that, I would say, as soon as we were in the incubator, then the direct conversations with affiliates really started and were really facilitated by Stephen and his team.
Yeah, definitely. I think you covered it. It wasn't part of the application process that we were working with an individual affiliate, but one of the benefits of the incubator was that they have insight on what these affiliate programs are specifically working on. You go to community, not everybody is interested in the specific thing that we're working on, but VOA National knows who is, and so they can connect us in a very targeted way and help build those connections and relationships for sure.
And by the onus was on us, and will remain on VOA to help facilitate that. And by doing it, we are accomplishing part of our goal, which is to build capacity and innovation and entrepreneurship skills within our organization, not depending on them necessarily to have it, but by partnering with entrepreneurs, you know, that they get the benefits of that. But you know, it's hard, and I'm sure Alec and Claire, if they had to do it themselves, try to go to nonprofit, you know, service providers, and you know, it's tough. It's tough to get in the door. It's tough to get those people to find time to dedicate someone to that kind of a partnership and initiative. It's, you know, it's not what we do every day.
Tim, anything on your end?
No, I think this has been such a great presentation. I've learned a lot. It's exciting to hear. Makes me want to go out and do something now. You really inspired me, all of you. So thank you for that. And thank you for being part of this today.
Yeah, thank you, Stephen, Abby, Claire, Alec. Thank you, everyone. It's been a fantastic presentation. Also, a huge thank you to everyone in the audience for joining us for today's web forum. I would like to remind everyone that the slides and recording will be available tomorrow on the Open Minds website. Also, the full Circle Elite Executive Roundtable series is available on demand as part of the extensive Open Minds library and is also available from the Open Minds YouTube channel as well. Please join us for our next roundtable. It will be on Thursday, January 19th at 1 p.m. Eastern Time. The topic will be financial tools for assessing financial sustainability. This roundtable is part of the Open Minds CFO Consortium, developed to provide executives with the tools and abilities to strategically assess and position their organizations for long-term sustainability and growth. Join Senior Associate from Open Minds, Ken Carr, as he discusses the Open Minds Financial Assessment Tool Suite, made available at no charge through the support of NextGen Healthcare, hosted on Whole Person Care headquarters. For a full list of upcoming roundtables or to register for the January 19th event, visit the Executive Roundtables page under the Events tab at www.openminds.com. Thank you very much. Okay.